I'm doing a self-administered oral mech exam. So first I would look at the face and see if there's any symmetry issues to the face. Looks like everything looks fine. Then I would move on to the lips, ask the patient if they could pucker. Very good. And while they've got their lips puckered, fill it with air. We're checking to make sure that air doesn't seep out or anything like that. Next, I would ask the patient to smile for me, and I'm looking at the corners of the lips, making sure that the mouth moves. Then I would ask the patient to go O-E, 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 again watching the face and the lips and the articulation. Then I would ask for them to look straight at me, which would be the profile view, and physically check their jaw to make sure everything looked fine, felt fine. And then I'd ask them to look directly at me again and open the mouth very wide, move their jaw from left to right, checking jaw movement. Next, I would ask them, I'd instruct them that I'm going to put on a glove, we're going to go inside your mouth and look at a couple of things. You don't have to be afraid. I'd wash my hands beforehand and then I'd put on a glove. So I'd ask them to open their mouth wide and then use a flashlight to look inside their mouth. We're looking for pink and moist and any abnormalities. And then I ask them to stick out their tongue and move it from side to side and up and down. And then I'd ask them to lick their lips. And I'd demonstrate if needed. Then I'd tell them to imagine that there is peanut butter on the top of their mouth and they're trying to lick it off. So we'd start from behind the teeth and go all the way back to our palate. Just like that. And then I'd check the teeth, ask them to smile, and then I'd tell them that I'm going to put my finger in their mouth first, but I'm going to check their teeth. So I'd check the alignment of the teeth and make sure that there's nothing missing or anything like that. So I'd tell them first, put a glove on. Everything feels fine. I'd also check the teeth with a mirror, which I don't have, and make sure everything looked okay. Ask them to open their mouth and look at the palate. And then I'd tell them that I'm going to put my finger in the mouth and feel along the ridges. Everything feels normal. Then I'd go ahead and look at the soft palate. And I'd have them say, ah, 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 to see if everything's moving fine. Ah, ah, ah. And then I tell them, while their mouth is still open, that I'm going to check the uvula and the tonsils. Mine are still there. And then we'd move on to asking about gag reflex, if they have a gag reflex, like when they brush their teeth. Do they ever kind of gag? And if they answered yes, I'd reassure them that that's completely normal. And I'd be aware of anything such as excessive drooling or slowness to respond or anything like that, and mark them as abnormal in my findings. And then we'd move on to the rest of the exam. But those are the first 5.